click the panel on the WebEx system, you will see an audio, and you can either call in via telephone or use your computer to listen in. So if you're needing to dial in via telephone, just click audio, then telephone, and you'll see the dial-in information and access code. And then as a reminder, feel free to type in any questions into the chat. We will be answering questions at 2 points during the webinar, so feel free to get those questions in. Again, as Michelle mentioned, I'm Sarah Jefferson, the School Programs Manager with It's Time Texas.
Why is it not wanting to? Here.
So today we'll talk about what is a SHAC, so very general, just going over that each time we present on our webinars. And if you're looking for more information and looking to see what we covered the rest of this year, feel free to check out itstimetexas.org/SHAC for SHAC-specific webinars. Michelle will also be addressing campus improvement plans and how SHACs can help ensure that they're being implemented and the law. And then we'll hear from one of our winning SHACs for the 2016 SHAC Award. We'll hear from Frisco ISD, Sheila Gardner. And then again, we'll have that question and answer time. So school health advisory councils, what are they and what do they do? Healthier students are better learners. At a district level advisory council, that assists the district in ensuring that the local community values are reflected in the district's health education instruction. And we'll talk, next slide, we'll talk a little bit more in detail. So what is a SHAC? SHACs are mandated by the state law for every district to have one. Members should be appointed by the school board, and it's also a voice for parents and community. It's really a way for them to get involved and to share their concerns in a constructive manner. It's also important to have them advise on health to the district as a whole and the school board. And then SHACs review all health education curricula. They make recommendations on health-related topics, school nutrition, physical activity, or just a few of the hot topics. And then they make recommendations on district-coordinated school health plans and programs. And Michelle will go into more of that during her time. But it's really a way for, again, the SHAC to help ensure that principals are on board with campus improvement plans and that they're being implemented. And then also, a new recommendation is SHACs must review and recommend on recess policy. And then again, lastly, must review and recommend on joint use agreements or school and district community collaboration and strategies. And we've really seen this help SHACs across the state be successful when, you know, the district can't take on everything, but when they're using these joint use agreements and working with collaborative community partners, it really helps them implement the things that they're needing to do. Next slide. So the SHAC law, the chair or co-chair must be a parent. And again, this is a way for parents and community members to really have that voice and it not just be district employees. The SHAC must report to the school board at least once annually. And this is really important because the SHAC is able to meet the school board. They're able to get in front of them. It's not, I know some districts, not all, present in person, some just provide a written report, but both is really the best practice, providing that written report and then doing an in-person report. I know district SHACs that have done both have been really successful in getting their recommendations implemented. If you're looking for a stock report on how to organize your information, Leander ISD has a really good report that they showed their board. Again, the SHAC must meet 4 times annually. Some districts meet more than that. They do a lot of different things, and so it really just depends on the dynamics of your SHAC and where you are in the process. Are you just getting started, or are you very well-seasoned SHAC and very functional and operating well? And so, at least 4 times a year is the minimum. A SHAC must be comprised of at least 5 members appointed by the school board. And again, this varies by district. Some recruit parents by getting principals involved and then presenting their applications to the school board, or, it just really depends on the district. But again, 5 members appointed by the school board. And important, at the end, 50% or more of the SHAC members must be parents who are not employed by the district. Again, it's great for your superintendent to be involved, stakeholders and nurses, physical education teachers to provide vital information on specific topics, but it's a voice for parents of students in the district and for community partners. Next slide. So a new mandate, some districts are already implementing this, but it's to have a physical activity subcommittee, and that includes physical activity and a fitness planning subcommittee to address things such as recess policy. Consider issues related to physical activity overall. So again, recess policies are a big topic, and again, this could be related back to campus improvement plans and making sure that campuses are meeting the requirements set by the district. And again, making sure that policy recommendations to increase the amount of physical activity to improve the fitness among the students as well. And then most exciting of my slides, I want to provide recognition to the 2016 SHAC Award winners. In no particular order, we had, over 30 applications this year, and it was a very competitive year, which is it's exciting that all the districts, each district was scored 3 times by different people, and then the average was taken, and districts were within half a point of each other, and it was really exciting to see how districts have grown over the past few years, looking at their past applications and seeing just their progress. So we want to recognize Leander ISD, Dallas ISD, Northeast ISD in the San Antonio area, Leander's in Central Texas, Corpus Christi, and then Frisco also in the Dallas-Fort Worth Metroplex. So again, these districts will be recognized at our It's Time Texas Summit and on our It's Time Texas SHAC page, so you'll see that link at the bottom of most slides, and showcase their picture, and we just did a blog post on them, so if you see it on our social media, feel free to share with those districts. But more importantly, we know that SHACs many times don't have a budget, and the people who are involved are volunteering their time and talents to the SHAC and to the district. And we are providing them $300, which doesn't sound like a lot, but they really are able to stretch those funds to help support any type of SHAC event, initiative, policy, or just general promotion and recruitment of the SHAC. So again, congratulations to these SHACs for really setting a gold standard and sharing their resources with others to be successful, that's the exciting part, is their willingness to share. So today we have, again, Sheila Gardner from Frisco ISD, who will be talking later about their successes.
Thanks, Sarah. As she mentioned, I'm Michelle Smith. I'm the state coordinator for Action for Healthy Kids, and I'm also a member of the Austin ISD SHAC, have been since the beginning of time, it feels like. So we've been through a lot, and I feel like the schools advisory councils are so critical to anything to do with wellness and so useful for the district, for the superintendents, for the teachers, for everyone. Parents are able to do so many things outside of that process and infrastructure of the school district. So it's really important that the SHAC be able to function in a way that is supportive of the district and make sure that our kids are getting good physical activity and good nutrition. So we're going to talk today about something that's not exactly SHAC related, but it does relate back to the SHAC. Back in the, probably 6-8 years ago, we were talking about the fact that we have great school advisory councils. We were making progress on a lot of policies, but how were we going to make sure that they were being implemented when it got down to the campus? It's great if we have these district level policies, but where the rubber meets the road is at the campus. So how do we ensure that all the things we want to happen are happening? And we went to the legislature and said what we'd really like to do is make coordinated school health and the other issues around wellness as part of the campus improvement plan. And so a bill was passed that allowed us to have a little more push at the campus level and ensure that coordinated school health and physical activity were being addressed at the campus level. So this law was passed, I think, back in 2009, and all schools should be including coordinated school health and physical activity in their campus improvement plan every year. But it's good for the SHAC to check in and make sure that this is something that's still happening. Some SHACs I know have actually asked that they are able to see the campus improvement plan information as it relates to coordinated school health. So that's some of the things that your SHAC can consider is how can you best use the information that is being submitted through the CIP process around coordinated school health. So here is basically the law, and it relates to elementary, middle, and junior highs. High schools are not included. They're not required to have coordinated school health, so their campus improvement plan obviously does not have to address that. One of the things that we wanted to make sure of was that good information was being used to make good decisions at the campus level. So the first thing we asked for was that student fitness assessments, as well as any other data from research-based assessments like the School Health Index, which is a great planning tool, or information that's acquired through Shape America, which is TASB in Texas. Any of that information that is available to the school should be reviewed and should be discussed when developing your plans. Also, in most CIP campus advisory committees or site-based committees will review student academic performance data on a yearly basis. So that should be included. That's important. Attendance rates are also important, and those are impacted based on the health of our kids. So, of course, those are things that should be considered when you're developing your goals and objectives. Also, percentage of students who are educationally disadvantaged, and then the use and success of any method to ensure that students participate in moderate to vigorous physical activity during their PE time. So in elementary school and middle school, there are requirements for physical activity, 135 minutes per week for elementary schools and 4 semesters in middle schools. But there was no requirement for making sure that they were physically active. So this was to ensure that each campus was considering So in PE class in the old days, you could be sitting on the bleachers while some of the students were participating, and you may sit there for the whole time and not even be active. And we don't want that happening. We want to make sure that all of our PE classes are active at least half the time. We do know that there are things in PE that you're learning life skills that will keep you healthy for a lifetime, but we need to make sure that half that class is active. And so this was another reason that was put into the campus improvement plan. And then we left it open for an opportunity if your school health advisory council is concerned about specific issues in your district. For instance, that you have an issue around food being used as a reward, then you can make sure that each campus, the Health Advisory Council can say we want each campus to consider adopting a policy around rewards. Sarah, can you put yourself on mute? I think you're still unmuted, and I can't seem to mute you. So a part of the law is
I'm unmuted, or
you are
unmuted.
You are unmuted. I keep hearing background noise. So basically, if the campus is elementary and middle school campuses, you need to be setting goals and objectives for coordinated school health programs at that campus. And each district should have approved a specific coordinated school health program that you're implementing. There are 4 that were approved several years back by TEA, Benestar, Catch, Spark, and the Great Body Shop. And you will find that information on the TEA website. You will also find information if you are interested in your district is doing its own coordinated school health program and not using one of the approved programs. There are criteria that have to be met for your district. So if you'll notice in your control panel, it says handouts. And under handouts, you will find 3 things. You'll find this presentation, the actual PowerPoint should be there, and then a criteria for coordinated school health programs for Texas. And that is what you would use if you were developing your own coordinated school health program at the district level. And then a campus improvement plan checklist, which is something that could be shared with your campuses to help them determine if they are fulfilling their requirements for a campus improvement plan. So just to give you some ideas of what you might have as far as language, when you begin starting to set your goals and objectives, the first thing you want to do is identify which curriculum or program you're using. Our campus is implementing the Catch curriculum to fulfill our requirement, or our campus has developed and implementing a coordinated school health program that meets the criteria that we just shared with you. That would be your start. Then you would need to identify goals and objectives at the campus level for that coordinated school health program. It could be as simple as putting together the timeline. We are going to have a family fitness night in the fall. We're going to do taste testing with our parents in November. We're going to share healthy recipes. We're going to do brain breaks, whatever things that you feel, or and how you're going to do this. You're going, for instance, I know with Catch, a lot of times the Catch lessons could be presented during advisory committee or during semester PE, but identifying specific classes or how exactly these programs are going to be implemented is important. And then the objectives for the program is what we're talking about as well, how you're going to accomplish the goals of having students be physically active and encouraging parents and staff. We talk mostly with Action for Healthy Kids about nutrition and physical activity, but those are only 2 of the now 10 components in the whole child model. The coordinated school health is an 8-component model that we've used for many years, published by CDC. And they worked with a couple of different organizations to expand that model to 10 components, which puts a little more emphasis on family and community as 2 separate things. But I think Sheila's going to share a little bit about that when she talks about their SHAC and how they're doing those things. But So anyway, your objective is to not just look at nutrition and physical activity, but you need to look at mental health, staff wellness. There's all different 8 components, and your campus should be considering how you can implement all of those different programs. Then the part we mentioned earlier, reviewing student fitness assessment, where FitnessGram is the mandatory assessment tool for the state and gathers a lot of good information for the campuses to be able to review and track. Our organization, Actual Healthy Kids, actually has a modified school health index, which is a little bit less fewer questions than the one that you'll find at CDC, and you can use that as a way of tracking your progress. It is critical to look at all the different components that wellness can impact. And I think, again, Sheila's got some information she's going to share. And this information is critical, not just at the school level, but at the district level to help the district administration and the school board understand how important health is to student success. So making sure that all these things are reviewed when you're working on your campus improvement plan is important. Then, as we mentioned earlier, how you are going to ensure that students are getting some moderate to vigorous physical activity during the day. We listed some of the possible options, having classroom teachers provide activity breaks, and then possibly having open gym before or after school, having outside activities after lunch when you're in middle school. I know when our middle school, we had open gym in the morning and then actually in the afternoon, and then during lunch we had parents come in so students could go outside and play on the soccer field and do things to make sure that they were getting as much activity as possible. And then being able to track this and share this information as part of the campus improvement plan is important. This is another example of what you might put into your campus improvement plan, just to state the fact that your PE teachers would ensure at least 30 minutes of each class is devoted to physical activity. I know one of our middle schools actually had their kids come in and immediately start walking the track or walking the gym or doing something so that they were active as soon as they got there. And then they would begin the process of whatever activities they were going to be doing that day. But the PE teachers can be really creative in finding ways to get active. We just make sure that you capture that information as part of your CIP. And as we mentioned before, the district SHAC can also suggest different information that should be reviewed or different specific things that your SHAC might want to consider or have your campuses consider, whether it's around fundraising. I know up in Round Rock, all of the campuses are required to have a family fitness night so that the families can come in and find out what their kids are doing around physical activity, and they can taste test what the cafeteria has, and they have local community partners come in, and possibly the hospital do blood pressure checks, or martial arts teams come in and do demos. But that's part of what each campus does. So that's part of their campus improvement plan, that they will be having this family event, and that specifically supports the parent involvement as well as physical activity and nutrition education that's part of the coordinated school health program. As I mentioned, there is a campus improvement plan checklist. This is what that checklist looks like. Specific things like identify your coordinated school health program. Do you have goals and strategies? How are you ensuring PE class has 50% MVPA? Mention policies regarding food or for fundraising. State there will be alternatives to food as rewards. These are things that you could include. You don't have to include all of these, but these are the type of things you would include in your CIP. And this is just basically set up to give you a little bit more additional guidance on developing your CIP. So I don't see any questions in the Dropbox. If y'all want to think a little bit, if you have specific questions, you can type those in, and then we'll open up and answer any questions or after Sheila does her presentation. So I am going to turn this over to Sheila. Do you want me on your?
Hello, hello.
Would you like this on your first slide, or you want to stop here for a minute?
Am I muted?
Oh, I'm fixing to unmute you. There you go. Okay,
All right, am I on there?
you are on.
All right. My button still shows that I'm muted, so I'm hoping everybody can hear me. I'm Sheila Gardner. I'm the Director of Coordinated School Health here in Frisco ISD, and I am very honored to be recognized by It's Time Texas for all of the work that our SHAC has done. It is a team effort, and I could not do it alone without my School Health Advisory Council. So some wonderful, wonderful parents and people in the district that helped put all that together. So let's go to the next slide, and we'll talk about kind of how this all began. The superintendent, Dr. Jeremy Lyon, wanted to bring more focus on the health and wellness here for Frisco ISD. And so he created my position 2 years ago. He wanted somebody to direct coordinated school health. At the time when that was the title given to my position, whole child was just coming into play. So I guess it could be called either one now. But the focus being that healthier students do better in school to improve the academics and what's happening in the classroom. He really wanted to put a focus on the health of the students. So the SHAC existed before I got here, of course, but it was a small group of people, and many of them are still on my SHAC today, but they would say, I guess, that they felt like they were spinning their wheels more and not really accomplishing anything because it was a small group and they didn't really have direction. So I started with getting out the word through our website and our PTA Healthy Lifestyle chairs to get people involved, to see if we could reach out to people in the community who had a background with health and wellness, who this was something important to them, and would they support us. So that being the focus, we had a zillion applications come in, and we took our SHAC from about 4 to 8 people to about 50 people pretty quick. So that was exciting for us. The larger group helped us, divide and conquer. We went from, like I said, 4 to 8 people to 50 people, and with a new focus being on the 10 components of the whole child model that was put together, it really helped to have all hands on deck and to be able to utilize all of these people. So we started with establishing committees on each campus, and a committee on each campus was to focus on what we called the whole child. So we had whole child committees on each campus, and in that whole child committee, we broke it into 2 subcommittees. We had a safe school committee and a health and wellness committee. And we asked on every committee, we have 64 campuses here in Frisco ISD, so we're quite large, and it's if we could get everybody kind of on the same page and have those committees set up on the campus to focus on what's important at that school for their health and wellness and for their safe school, that gave us a connection as far as SHAC to be able to go out and know who we were meeting with on the campuses. So on these committees, we asked that it be an administrator, principal, assistant principal, one of those to be on the committee, a counselor, a PE person, a health teacher if there was one, and a nurse. So, and then of course parents and students to be on those committees. So once those committees were established on every campus, that really gave us some, feet on the ground to get some work done on the campus level. From the district level, we developed a strategic plan. That was the big focus for our district, is to come up with a big district strategic plan to give our district a direction for 3 to 5 years and what they wanted to focus on. So the district broke this into about 6 different areas, from teaching and learning, human resources, budget, facilities, communications, the basic things that a school district focuses on. But they also wrote in the district strategic plan whole child. I dare say that's in many school districts' overall arching strategic plan, is to have a focus on the whole child as what the district decides to focus on. So it's interesting, and our district strategic plan is up on our website, so anybody can go take a look at that and see what we focus on when it comes to whole child. So that really gave my position a direction as to what I was to try and tackle. And when I say my position, I really mean SHAC. SHAC was my backbone. SHAC is my backbone. Anything I do for the district for health and wellness is always run through SHAC, run with SHAC, in conjunction with them. So they are my everything. So let's go to the first slide, and we'll kind of go through the 10 components and take a look at what we focused on this year and how we worked through our 10 components. So without reading you about what each component is all about, I kind of put that on there to give you an overall idea about what the first component, health education, was about. But I'll talk down below about what our SHAC was able to support. We created flex special aids on the elementary levels to go in and support the PE teachers. And a half credit, of course, for graduation is still required in our high schools. In order to graduate from Frisco ISD, you must have a half credit of health. Even though the state took that away, saying that the districts didn't require it, we still kept that as a something that was really important to Frisco ISD. So the SHAC was instrumental in doing that. And then, of course, the big focus with the CPR training in our 7th through 12th grade. CPR training is required for graduation from high school. And it's really been a focus of Frisco ISD for quite some time, as we had a child collapse in the school, and a PE teacher was able to save her through the AED and excuse me, the CPR training that the teacher had. But just recently, in the last couple of months, we had a child who had received CPR training through her PE class who was able to save her father, who had a heart attack at home. So that's an inspirational story that should be on the American Heart website pretty soon. So it's nice to have SHAC as backing all of that. Let's go to the next slide and talk about our nutrition environment and our nutrition services. We have an amazing child nutrition department run by Deborah Trudenick here in our district. She is always on the forefront of what's important in health and wellness, and has been absolutely instrumental in working with SHAC and putting that wellness policy and guidelines in place. So that's been something that she goes hand in hand with SHAC and myself in putting that together, so we're proud of that. She does Eating Around the Rainbow with the elementary kids, where she will provide a table that looks like a rainbow of fruits and vegetables in all these little cups, but she arranges it in a rainbow, and the kids can go up and sample from this rainbow to eat from around the rainbow. The kids get really excited when they get to do that at elementary level. We have salad bars at all of our elementary campuses now for our staff to be able to have salads every day, and for our students to be able to get something nutritious if they didn't want the standard meal. So that's exciting. We have once a month what we call Tri-Day Friday. Our SHAC members go out and help support this, where the child nutrition comes up with some kind of interesting fruit or vegetable that's the thing for that month, and we serve it to all students. It's free of charge, whether they are on a meal plan, whether they brought their lunch from home. Everybody gets to participate in Tri-Day Friday. One of the ones they did recently that I enjoyed was a roasted chickpea, and it was like a potato chip, only it was a chickpea that was roasted and had some flavor to it. So kids love that. And of course, we follow the Smart Snack guidelines that is put in place by our USDA. Let's jump down to the next slide. Employee wellness. You know, if our employees are healthy, they will put some focus on health of the kids they get to take care of every day, and so we think it's important to take care of our staff as well. SHAC was very instrumental in helping us do a campus walking path. While we can't all have tracks and walking tracks or paths around every campus, all campuses have them. It's called the sidewalk and the parking lot, and if you use Google Maps, you can draw out a walking path around a campus and present that to the staff. So our SHAC was instrumental in doing that, creating half-mile, quarter-mile tracks around every campus, and then providing the staff members on those campuses with a map. And at the bottom of the map, it gave them some information that they could use, such as if you take your weight times 0.57, it will tell you how many calories your body would burn in a 1 mile walk of casual walking. So it encouraged them to see themselves doing it because they could put a little personal piece into it. That has been well used at all of our campuses, and they feel like they all have a walking track around their campuses now. And I'd share with anybody how to create that, but that's something that anybody can do and start providing for their campuses tomorrow. So we did a lot of staff health challenges. We asked the schools to challenge each other and come up with who can have more steps, who can drink enough water and have enough of their fruits and vegetables. And we have a whole packet on a health challenge if anybody's interested in that. But we got a lot of schools competing against other schools, and then just within one school itself, challenging the staff on just an individual campus. Staff challenges used to be the Biggest Loser competitions, and now it focuses more on a lot of different health components rather than just on weight loss. One of our partners that we couldn't do it without is our American Heart Association. We did a check, change, control blood pressure program, encouraging our staff members to check their blood pressure and get with their school nurse if their blood pressure was not as it was supposed to be, and enter it into a program to try and track their blood pressure. And we had several good stories come out of that, of how many people discovered they had issues and were able to go to the doctor and take care of it before something bad happened. We always do the Go Red campaign. We've been doing that the last 2 years here in Frisco ISD to support the American Heart Association as well, and allow our employees to be able to give back and focus on their heart health. Let's go to the next slide. What's our next one here? The social and emotional climate. We have a wonderful guidance and counseling office run by Brenda Berry and her staff that really focuses on trying to positively affect the school climate. Mental health is a big focus. A lot of school districts these days, because there are so much pressure put on kids with all of the testing, and we don't want to have all of the high anxiety rates that we see happening out there, and want to be able to make a difference in a child if they're having any suicidal thoughts, any depression, those kind of things. So on our whole child committee on every campus, we have a subcommittee under that called the Safe School Committee, and that is what they focus on. We have a SHAC member then going out supporting each one of these committees, and so we have a SHAC member represented on each campus to bring this information back to the district level and let us know how we can support them more. Our big focus this last year is to just do an inventory of what we're currently doing on the campuses. It starts with that. If you don't know what's happening at all of the different schools that you have out in your district, you don't know where to begin, and you'll uncover some pretty neat things that are happening out there that they just do how they've always done, but no one's really noticed. So it's interesting, and our SHAC has come back with some pretty exciting stories of the things that are happening out there on campuses. But Safe School Committee is a big part of trying to positively affect that social and emotional climate. Let's go with the next slide. The physical environment has a lot to do with what the building looks like, what kind of structures you have in place that ensures that the students are in a safe learning environment, that the building is safe, that they feel safe when they're inside. So the newsletters, bulletin boards, having positive messages on them. We have crossing guards at all of our schools. So making sure our recess equipment is safe. Our SHAC members will walk the playground and make sure that what's happening out there in the equipment is well maintained. We have a great maintenance department who will go out if our SHAC members find anything that doesn't look right in our schools. So that's always nice. The next one we focused on was health services. Health services deals more with our nursing. Let's go to the next slide. Our nursing department, run by Kathy Tolbert, provides, of course, first aid, and I always say they put the Band-Aids on our kids that need it the most out there and do all kinds of things to take care of the true health of our children. But they do a lot with the flu clinics, our health screenings, the back-to-school immunization clinics. If you know a school nurse, there's sometimes somebody no busier than a school nurse. They're just always having somebody in their clinic and always taking care of being the first responders on a campus to take care of a child who is not feeling well. So our SHAC tries to support them in anything that they may need when we do our big health fairs at the campuses. Our SHACs are instrumental in putting on health fairs. Most all of our campuses now have a big back-to-school health fair or a health and fitness night that our nurses are very involved in. The next one is our counseling, psychology, and social services. We kind of put this together with our social and emotional climate when we meet as a committee and focus on, again, what our Safe Schools Committee does, that our Safe School Inventory was very important. And if anybody wants to see a list of all of the things we're doing related to Safe School and all of the things this Whole Child Campus Committee does, they can contact me and I can share with you the list of the different things that we have going on out there. But it's really important that the SHAC supports them in whatever each individual campus wants to do and brings that back to the district level to see, are we all on the same page with this? Is this a need that all of our campuses have? At our high school level, we started a classroom connections meeting. So once a month or once every 6 weeks, the classrooms stop and discuss a topic, and the counseling and psychology, our guidance and counseling office, put these talks together in collaboration with each campus to make sure that we're getting the message across to the kids that is vital or important at the time. Our SHAC members are also very instrumental in helping to write some of these presentations that go out to our kids. And when you've got such a knowledgeable group of parents who work in the fields out there of health and wellness, it's great to pull on those resources to help with the information you want to provide to the students, because sometimes we think we're the experts because we're the district level people, but we really have some amazing parents out there that are truly the experts. The next slide deals with our community involvement. That is the main focus of Frisco ISD, partnerships, partnerships, partnerships. We are very blessed to get to call American Heart Association, our best friend. The Dallas Cowboys are moving to the Frisco area, from the mayor to the city council to businesses. We feel like we're all in this together, and sometimes it's hard to know who's with who because we all have the focus of bettering our community and doing it for the right reasons to take care of our kids. So our United Way and Cooper Institute provides us grant money and recognition every year with our United Way and Cooper Institute Healthy Zone grants that they give us. The First Tee has been amazing, providing golf equipment and curriculum for our elementary schools. Medical City Children's Hospital, my goodness, we did the 21-day healthy snack challenge with all of our elementary kids, and the difference we were able to make with that has been just phenomenal. Couldn't do it without Ryan Eason, who is overseeing that program. But the SHAC is the people on the campus level that works with the Healthy Lifestyle Chairs, and a lot of times it could be the same person, the PTA Healthy Lifestyle Chairs, to get the message across to the kids to try and increase their snacking challenge. We were able to increase their consumption of good fruits and vegetables during the snacking challenge and lower the rate in which they're eating potato chips and cookies and soda. And we were able to collect some great statistics on that, so I'd be happy to share that challenge with anybody. We always do an entire district community fun run to kick off the year. We call it the Gary Burns Fun Run. And anybody who's anybody comes out. We have every school sends people out. We have representatives, district parents. We have thousands and thousands from the city, and just parents and kids. A great day to bring the whole community together. Our Fuel Up to Play 60 grant with the Cowboys. We do a lot of work with the Cowboys and the dairy farmers in our Fuel Up to Play 60 initiative. So that's been amazing. Relay for Life, that just concluded from this last Friday night to support the American Cancer Society. Of course, the Dallas Stars are right here in our own backyard, so we partner with them a lot, and Cook's Children's, of course, on our Go Noodle project, and that is activity brain breaks in the classroom that teachers are able to use to support their academics and to still give the kids a brain break in the classroom. So if you have not heard of Go Noodle, please check that out. Please contact me. I love the Go Noodle brain breaks, and so I'll be happy to share with people more information on that. And the next slide, number 9, family engagement. I consider family and community all in one. That family really brings us back to our PTA. We have the most amazing PTA who will support SHAC. SHAC supports PTA, healthy lifestyle chairs. I feel like we're all one, like we all bleed into each other. It's just amazing. But from our Kids Teaching Kids 21-Day Challenge, our Jump Rope for Heart that we do. We also do Hoops for Heart in the middle school level. Healthy lifestyle PTA chairs. We have a district level healthy lifestyle person who supports all of the healthy lifestyle chairs on the campus to guide them as to what do you do as a healthy lifestyle chair. We've got some good people to pass down their information from year to year what a campus should be doing, focused if they are focused on health and wellness at their campus level. So Pink Elementary is probably one of our best elementary schools, and that healthy lifestyle chair out there, it just rocks. She's got a binder put together of step-by-step of everything you could do. So if anybody needs connections on there, I can get you connected with her. Health fairs. We really think it's important that every school has their own health fair, as well as our big district one, that has really increased at our elementary level especially. Health fairs have just, gone crazy. Field days, of course, that happens every spring. It's a good fun time for SHACs to get out and support some fun that the kids are doing out there. And our fun runs, our fitness nights, a lot of our health fairs combine with fitness nights. And a lot of what our PTA and family events are focused on this year really have been focused around fitness nights and health fairs rather than a pizza party and a movie night. So that's been nice. And then the last one, physical education and physical activity. My background is a PE teacher, so this is where my heart bleeds the most. What our PE teachers do every day, you just can't say enough about the way they can, get a gym full of kids all active, all moving, and learning all at the same time. It's just amazing. We have a lot of before and after school clubs, from running clubs and jogging clubs, basketball, Jump Rope for Heart, jump clubs, hoop clubs. So that's absolutely vital to get kids active before or after school. Of course, our Go Noodle fitnessgram assessment, we take a lot of pride in making sure we are assessing the students and giving them the good information that they need to know to improve their own physical fitness. We use the Spark curriculum here in Frisco ISD, and I've mentioned some of the other ones on there. And of course, we do off-campus PE, and athletics is always a big, big focus. So I feel like I've rattled on forever here, but those are our 10 major focuses, and it helps in going through, when you don't know where to start, what should SHAC do, where should SHAC begin, you can just start with one component at a time and just decide what are you going to try and tackle. And so some of those little areas that I had in the little boxes below hopefully will give you some ideas to say, let's just try this, let's figure out what this is, and just pick one of those under each component, or just pick one component and see if your SHAC can tackle that. You'll feel successful. This next slide, SHAC is making a difference. This is after our 21-day Kids Teaching Kids challenge that we did with Medical City Children's Hospital. We were able to show through a pre-test and a post-test that of our elementary kids, we lowered the chip consumption down 16.3%, Our cookie consumption went down, our soda consumption went down, and our fruit and vegetable consumption went up. That was pretty exciting for us. It helps when you can collect data on what you're doing, because data will drive decisions that we must be doing something right if these are statistics. So, and we know that teens who are active in schools are 20% more likely to get an A in math and English, and students who get at least 20 minutes of recess per day have a lower BMI. So SHAC wants to make a difference. SHAC knows that these are the reasons, these kids are the reasons we do what we do, and hoping to collect some good data going in the right direction, making a difference in these kids' lives. Our last page is just, of course, our resources. But feel free, anybody can contact me at gardneris@friscoisd.org. I'd be happy to share any of the information with you from our webinar today, or answer any questions that you may have, because I'm passionate about what we do, and we know we're doing it for the right reasons. And if I can help any other school district, any other team, any other SHAC across Texas get started, any healthy lifestyle chairs, we're all in this together, so be happy to help.
Thank you so much. That's awesome. You guys are doing a lot in addressing all of the 8 components. I'll tell you, in Austin, we don't get to all 8 components every year, but we do try to prioritize and at least educate our SHAC on the different components every year. What I've got the next couple of slides. I'm sorry?
I was going to say, I know that it's important not to overwhelm your SHAC and try and work them to death. Because we had so many SHAC members, we were able to spread out the work we do. But a SHAC member wants to feel needed and important and not waste their time when they come to meetings, and really have a vision and a direction and feeling like they're making a difference on what they're about to tackle. So not biting off more than you can chew, but not just spinning your wheels, not really accomplishing anything. There's a fine balance between those two.
I agree. The next few slides are just basically resources that can help you. There's a policy database that NASB put together that has examples of different policies. The whole school, whole child, whole community model is available at CDC. CSPI is a group called Center for Science and Public Interest, and they have a guide for improving school food and beverage environment, helping you with healthy fundraisers and other healthy vending. And then CDC, that is the link to the School Health Index. The Department of State Health Services has a SHAC guide for anyone who is getting started or restarting and needs information. TEA has all of the different approved coordinated school health programs. Healthy Lifestyles has its own page and has a new chair this year, Karen Burnell, who is doing a fabulous job of working with schools and getting these healthy lifestyle chairs going. The Department of Agriculture has the Square Meals and has a lot of information on wellness policies as well. And then we've mentioned the It's Time Texas SHAC page, which is we'll have this webinar along with other webinars, along with other resources for SHACs. And then the actual laws about school health advisory councils and what is mandated is available at TEA as well. Finally, these are the coordinated school health links for different parts of coordinated school health. And then there's, I think there may be some repeats here. These are all available. If you did not hear in the beginning, you should be able to download as a handout this PowerPoint as well as the checklist and the criteria from TEA. So if you have any questions, I have one here I'm going to ask Sheila to chime in on, and then I can add a little bit to that. How do you get parents engaged and involved with school health advisory councils? And this is one that we get asked a lot. Since 50% of your SHAC should be made up of parents who are not employed by the district, where do you find these parents? Sheila, what's your best advice?
We put something out on our website, and we'll probably be putting it out there in the next couple of weeks, that says, if you have an interest in health and wellness, if you would like to make a difference in the health and wellness world of the children and the staff in Frisco ISD, please fill out this short little application to be on our School Health Advisory Council and to value their time and their effort. We had people just coming out of the woodwork. There are parents who their background is nutrition. They work as doctors and nurses, and they're out there every day. This is what they do for a living. So they would gladly sign up if they knew that it would make a difference. But it is hard to get volunteers if they think they're just going to be worked to death and that their opinions don't matter and that their work isn't going to matter. So we really stressed to them that we valued what they had to say and that their recommendations would go before the school board. So they took heart in that. And every school had a healthy lifestyle chair, and a lot of times it was those people then who turned around and wanted to be at the SHAC level. So I haven't had a problem with that, but relationship building and team building is something we feel strongly about here in Frisco ISD.
That's great advice. I can say, the application is a good idea. We have an application online. We've also been successful in doing surveys. If you can get to your campuses and ask them, as like you mentioned, if they know they're being listened to, they're going to be more likely to be involved. If you can get your principals or at the campus level to do a survey of parents and what do you think is the most important health issue that your children are facing, and what do you think of the school physical activity environment or recess, or how do you feel about food fundraisers? Get those questions out there, and then at the end of the survey, ask if you're interested in working on these issues. Please give us your email, and you'll be surprised how many people, once you ask them what they think, are more likely to want to be involved. So I think surveys is something that's really helpful. And then we ask our school board to appoint members. The law says that the school board will appoint members, but in most cases, we take a list of potential members to them, and they just basically bless the list. But we do ask them to, look for parents who are interested, or if they get asked about things. We just had a gentleman come in and testify about recess this week at a board meeting during the community comment time. And guess what? He's going to be a new SHAC member because as soon as we found out he was interested in recess, we were contacting him and saying, if you're interested, we just did a recess policy. We're waiting for district approval, but we'd certainly like to have you involved with our SHAC. So that's a couple of things I can suggest. And that, I don't see any other questions. No one else have any questions for us? We're pretty close to running out of time.
And if anybody wants to contact me to get a copy of the application that we send out to the parents, I think your idea of asking their comments through a survey spurs their interest, and they think then they could make a difference on those topics. They generally want to get involved. But again, my email is gardner@friscoisd.org. You can probably find it on the Frisco ISD website for Sheila Gardner. I'd be happy to help anybody with concerns they have regarding their SHAC.
Thanks. This webinar will be posted, and we will send a link out to everyone who registered. So it will be on YouTube. There are a lot of different webinars on there that we've done over the past few years around healthy lifestyles, SHACs, wellness policies. So if there's something you're looking for, you can check there. You can also go to the itstimetexas.org/SHAC webpage and find the SHAC webinar specifically. We hope this has been helpful. We'll probably look at doing some additional webinars next year. There's always new people joining in schools. It's kind of a cycle. The SHACs will go great for a while, and then they may kind of wane a little bit, and they need to be rejuvenated. So if you're going through that kind of experience, you might want to look at one of these webinars and try to get some of your parents or your SHAC to watch it and learn a little bit more about the basics. What is a school health advisory council, and what exactly they do. So thank you, Sheila, so much, and Sarah, thank you, and It's Time Texas for partnering on these webinars. And we hope that you guys have a great end of the school year and stay active over the summer. And we'll be talking to you in the fall.
My privilege. Thank you.